Hi there. Very nice to meet you. My name is Dr. Matt. How are you feeling today? Okay, wonderful. Well, I'm so sorry you're not feeling that well, but I will be able to take care of you today if that's okay with you. Great. So, can you please tell me what brings you in exactly? Okay. I would really like to write this down. Okay. So you're in a lot of pain, I understand. On a scale of 0 to 10, how bad do you think your pain is? 0 is the least pain, 10 being the most painful you've ever felt. Okay. Well, in that case, I definitely need to have you checked in today. Thank you for coming to our urgent care. I believe we might have to do a cranial nerve exam on you, but let's go ahead and just dive into the medical history. Make sure that we have all the information necessary, and after that, we're gonna go ahead into the medical exam. Does that sound okay? Okay. Do you have medical insurance? Okay. We're gonna need to make a copy of that, so whenever you're available, we can take it. Okay. Thank you. Very good. Good. So we're just gonna make a copy. We're gonna bring it back. Do you have any allergies? Not that you know of. What about medical history? Okay. Any heart problems? Any digestive problems? Urinary problems? Not really. Okay. Do you have trouble sleeping? Sometimes. And how often would you say? 3 to 4 times a week? Okay. Is there anything that helps? Just relaxation and... Okay, you like listen to ASMR videos. Wonderful. Okay. Do you have any diabetes, depression, hyperlipidemia? No. Good. Are you on any medications right now? Okay. Are you taking any vitamins? Okay. And who was your doctor before us? Okay, good. Let's see, what are we missing? I believe we're not missing anything. Now we just need to take your vital signs. We're going to take your blood pressure, your oxygenation, your respiratory rate, and your heart rate. Okay. Do you think you have a fever right now? And did you have any cold and flu-like symptoms in the last 2 weeks? No? Okay. Great. So let's go ahead. I'm just going to set this on the side. First, I need to wash my hands. And in the meanwhile, I'm just going to ask you really what happened, what kind of symptoms you're experiencing. Are you having any double vision or blurred vision? Okay, so you're having blurred vision, double vision. And are you having any type of headaches? And were you experiencing those headaches in the front or the back of the head? More in the front. Okay. Yeah, that could mean so many things. Until we do a CT scan or an MRI of the brain, we won't really be able to tell much, but hopefully the medical exam from today, the cranial nerve exam, is going to tell us a lot about your medical condition that you're suffering from right now. Okay, let's go ahead. We're going to first take your temperature. This is going to go on your forehead. And just stay still for me, please. Okay, very good. So you don't have a temperature. And now I'm going to take your oxygenation. So I'm going to just turn this on. And this is going to go on your finger. Okay, yeah, just any finger. it would work. And this measures your heart rate and your oxygenation. So just take a deep breath in for me, please. And exhale. Very good. Can you do that one more time? Take a deep breath in. And exhale. Okay. So your heart rate is 75 beats per minute. Your oxygenation is 95% on room air, which is very reassuring, I would say. And let's go ahead. We're going to take your blood pressure now. Do you have an arm preference, or is there, anything wrong with any of your arms, like we shouldn't use them? No. Okay. Okay, so I think I'm just going to use your left arm, if that's okay. So just make sure that you have both feet on the ground and try to relax as much as possible. Okay, so your blood pressure is a little bit elevated, 145/60. Your systolic is the one that is elevated, 145. I'm not very concerned, but I'll keep an eye on it. Okay. And next I would like to listen to your heart and your lungs, if that's okay. Okay. So just relax for me, please. First, this is going to go on your heart. And I'm just going to need you to relax. Breathe normally. And I'm just going to move the stethoscope a little bit to the middle of the chest. Good. Okay. Everything sounds normal so far. Nothing to be worried of. Okay, so the sounds that we want to hear are lub-dub, 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 which is S1 and S2, no S3, no S4, and everything sounds really normal. Okay, now we're just going to switch, and we're going to listen with the bell of the stethoscope. So I'm going to put this on your chest, and just like I suspected, no murmurs. So that means no valve abnormalities noted. Good. And I'm just gonna move down to the pulmonic area. Okay. And I'm just gonna move to the left side. Okay. Everything sounds very normal. Now I'm gonna switch back to the diaphragm, and we're going to listen to the chest. So we're going to take a deep breath in and exhale. Good. Can you do that one more time for me? Take a deep breath in and exhale. Okay. Now we're going to listen to the side. So can you do that? Take a deep breath in and exhale. Okay, and I'm gonna go ahead and listen to the other side. So go ahead, take another deep breath in and exhale. Very good. Okay, now I'm gonna ask you to lean forward for me, please. Yeah, just lean forward and do the same thing. So take a deep breath in and exhale. Very good. And now I'm gonna listen to the other side. So please take a deep breath in Good. And now exhale. Okay. It's okay with you. I would like to feel your pulses, both of them. So I'm just going to put 2 fingers on each wrist. And I'm just going to compare. Good. I want to make sure that both pulses are symmetric. Good. Okay. So 2 plus, just like I suspected, and both pulses are symmetric. Good. Now I'm going to go ahead and palpate your face. Is that okay? So I'm gonna need to touch your face and make sure that you're not having any pain, any numbness, tingling. So let me know if anything abnormal that you're feeling. Okay? How does that feel? Okay. What about here? You feel anything? Okay. So you do feel, but it's not abnormal. Okay. Okay. Great. Okay, so now I'm just going to go ahead and feel your sinuses. Okay, we're going to do a facial sensation later, but for now I just want to make sure that we're not dealing with anything very scary. And everything seems to be super normal, so that's good. Okay. Okay. Wonderful. Let's go ahead and do a facial sensation just like we should. And this test is about you distinguishing if it's sharp or dull. So this would be dull. I'm going to touch your face. Let me know if you feel it. Do you feel that? Okay. And now I'm going to touch your face on the other side. Do you feel that? Very good. So that would be dull. And now we're gonna go ahead and do sharp. Let me know if you feel it. Do you feel that? Okay, good. And now we're gonna go ahead and do the same thing on the other side. Tell me if you feel it. Did you feel that? Okay. And did you feel it equally on both sides? You did. Good. So now I'm going to keep on doing that, and please tell me if it's sharp or dull. Okay? Okay. So just close your eyes, please. Sharp. Good. Dull. Okay. One more time. Dull. Okay. And one more time. Sharp. Okay. Very good. Okay. Now I'm going to ask you to close your eyes one more time, and I'm going to do another facial sensation test. This time I'm going to, just very softly touch your face. And you'll barely be able to feel it, but if you do, just raise your hand or just tell me I feel it. Okay? Do you feel that? You felt it. Okay, very good. Now I'm gonna do the same thing on this side. Do you feel that? Okay. Did you feel it equally on both sides? Okay, so it was just a puff of air. Very good. Now I'm going to do the same thing on your chin. Do you feel that? Good. And same thing on your forehead. Do you feel that? Okay. Excellent. I'm going to take a look inside your nose. This is called an otoscope, so just want to make sure that it's turned on. Very good. So what I'm going to need you to do is to look up for me, please. Okay. Very good. Okay. And I'm going to go ahead and look on the other side. Good. No deviated septum. Everything seems to be alright. Mucosa is pink and moist, and I didn't see any foreign objects in there. Now, what's very important for us is to make sure that your nose is patent and you can distinguish smells. So I'm going to palpate your nose. Okay, how does that feel? No pain there. And now I'm going to just press on one ear. Good. Breathe in, breathe out. Good. And I'm going to do the same thing on the side. Breathe in, breathe out. Okay, so you can breathe in and breathe out with both ears, so that's very important. And now I'm going to ask you to close your eyes, and I'm going to have you smell something with only one ear. So go ahead, block one ear. Good. And just keep your eyes closed. Okay. Can you please tell me what this smells like? Very good. That's coffee. Excellent. Okay, I do have one more smell for your other ear, so go ahead and switch. Good. So I'm just going to open this and I'm going to have you smell. Okay. It smells like lemon. Wonderful. Okay. Now I'm going to go ahead and check your mouth. So for this test, what I'm going to need you to do is to open your mouth as wide as possible. And I'm going to take a look inside first. We're looking for anatomical abnormalities. Okay. So just go ahead and open your mouth. Okay. And can you please stick your tongue out for me? Okay, just say ah. Good. And can you please stick your tongue out? Okay. And now move it side to side. Good. And now move it up and down. Very good. Excellent. And I couldn't notice any abnormalities. Your tongue is midline, your uvula is midline, and your tonsils are not inflamed at all, so that's very good. And now I would like to check your taste, if that's okay. Okay. So I do have a few different tastes available, and what I'm going to do is I'm going to put a few drops. I'm going to start with one drop actually for the beginning, and I'm going to put it on the tip of your tongue, if that's okay. Okay, so this is taste number one. Just go ahead and open your mouth. Good. Tastes like coffee. Okay, excellent. Let's go ahead and we're going to take one more. So I'm gonna need you to open your mouth. And what does it taste like? It tastes sour. Okay, very good. Let's go ahead and try one more. And I'm gonna have you open your mouth. Okay, and what does it taste like? Salty. Okay, so you distinguished 3 of the tastes, of the main tastes. I think that's pretty good for me. let's go ahead now. I'm going to check your ears. I want to make sure that you can hear very well and that your hearing sense is not obstructed. Okay, first I would like to touch your ears and make sure that the anatomical part of your ears is intact. Good. And let's see, where's my light? Okay, so I'm just gonna ask you to look right here for me. And everything seems to be okay. Now, look right here for me. Okay, everything seems to be wonderful as well. Now, I'm going to take a look inside your ears. Okay. If it hurts in any way, please let me know. So please just let me pull your ear on the other side. Good. I just want to make sure that I am able to visualize the ear canal. Good. Okay, so the tympanic membrane is pearly gray. No abnormalities noted there. Everything is intact. Let's go ahead and take a look in your other ear. This one. Good. So I'm just gonna have you look right over here for me, please. Just turn your head a little bit. Very good. And now I'm going to pull the ear a little bit to the side. I just want to make sure that I can visualize the tympanic membrane. No abnormalities noted there. Everything seems to be intact. Okay. No signs of extra discharge, no inflammation, no infection, and tympanic membrane is pearly gray. Anatomically speaking, everything looks great. Now I'm gonna go ahead and check your hearing. I'm going to make some noises, and please tell me how many times you hear these noises. Now I'm going to start with one side, so only one ear. 3, good. And now on the other side. Okay, also 3. Now I'm gonna go ahead and make one more time this noise. 2, okay. And again. Okay, very good. Now I'm going to create a few sounds. Please tell me when the sound stops, when you can't hear it anymore. Now, good. Now, good. Now, good. Now, good. One more time. Now, good. Now, good. Excellent. What I'm going to do now is I'm going to whisper a few words in your ears, and I'm going to need you to repeat them back to me, okay? Okay. 6, 5, 21. 6, 5, 21. Good. 5, 21, 30. Okay, let's go ahead and do that one more time. Gloves, wine, ASMR. Gloves, wine, ASMR. Great. Let's go ahead and do that one more time. Fire, brush, ASMR. Great. So it seems like your hearing is intact. Now I'm gonna go ahead and check your eyes. And you said you're having some blurred vision and double vision. Now this is going to be a little bit tricky. So let's say if you pass my test. Okay. because I'm gonna have to palpate your eyes. I want to make sure that you're not experiencing any kind of pain. Okay, so I'm just going to. Is that painful in any way? A little bit. Okay, what about now? It's very painful. Okay, now I'm gonna ask you to look in different directions and let's see if you feel the same way. Just look that way. Okay, now look to the left. Okay, now look to the right. Okay, now look to the left. Okay, good. Now look up for me. Good. Now look down. Okay, and you're experiencing some pain over there, right? Okay. Just go ahead, look straight at my nose. Okay, and I'm going to divide the field of vision into half, and I'm going to flash a light in your eyes. If it gets too uncomfortable, just let me know, but otherwise I'll continue with the test. Okay, just look straight at me. Good. Look straight. Good. And look straight. Good. And now I'm gonna go ahead and do the same thing on the other side. So go ahead, just look straight. Good. Look straight. Good. 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 Look straight. So your pupils are round and reactive to light, which is a very good sign. Now I'm gonna ask you to follow the light. This is a very simple exercise, so just look right here at the tip of my pen light. Okay, and just follow the light as best as you can. Try not to move your head and move only your eyes. Okay. So your left eye seems to go sideways, which is not very good. Do you realize that this is happening or not really? Not really. Okay, now I'm gonna ask you to look right here. I know this is going to be a little bit uncomfortable, so just look right here. And now look at my fingers. Good. Okay. Now look right here. Good. Now look at my fingers. Good. Now look right here. Good. Now look at my fingers. Okay. Look at my fingers. Good. Look at my light. Good. Okay. Now look at my fingers right here. Good. Now look at my light. Okay. Now look at my fingers right here. Now look at my light. Okay. Look at my fingers right here. Look at my light. Okay, just like I suspected. Now look down for me, please. Now look up. Now look to the side. Now look this way. Okay. Now I'm going to ask you to look at my fingers. Okay. Then look right here. Can you please tell me which fingers are moving, right or left? Good. 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 Now can you please tell me when you don't see my fingers in your field of vision? Good. 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 Okay, now just look at my finger and follow my finger with your eyes. Don't move your head at all. Good. 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 Now I'm going to ask you to tell me when you don't see my fingers in your field of vision. Now good. Now good. Now good. Now good. Let's do the same thing one more time on the other side. Now good. Now good. Now good. Now good. Okay. Now we're going to go ahead and check your reflexes. So I'm going to need you to shrug your shoulders. Okay, so just keep on repeating what I do. Good. Okay, just keep on doing that. Okay. Now I'm going to gently press on your shoulders, so you just keep on shrugging your shoulders up. Good. Now I'm going to put my fingers on your jaw, just like that. Good. And I'm gonna need you to clench your jaw. Good. Just keep it clenched. I'm gonna try to move your jaw side to side. Just keep it strong together. Good. Okay. And now I'm gonna ask you to look that way and just resist. Okay. And I'm gonna ask you to look the other way. Good. And just keep on pushing and resist. Okay, very good. So pretty much good reflexes for now. I'm going to tap on your chin. So just stay still. Okay. Now I'm going to tap on your forehead. So stay still. Good. Now I'm going to tap right here on the side of your jaw. So just stay still. And I'm going to tap on the other side of your jaw. So just stay still for me. Very good. Now I'm going to tap on your shoulders. Good. 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 And on your wrists. Good. Good. So everything seems to be normal. Next we're going to do a tuning fork test, and I'm going to create a vibration sound. Please let me know when you don't hear it anymore. Now, very good. And I'm going to do the same thing on the other side. And it stopped. Okay, so that seems to be intact, but I would like to try another tuning fork, which makes a different kind of frequency sound. So let's go ahead and see how that goes. And let me know when you don't hear the sound anymore. No. Okay. And I'm going to do the same thing on the other side. Good. Let me know when you don't hear the sound anymore. Now. Okay. Excellent. Okay. I believe I have everything that I need, and I'm going to send you for an MRI of the brain and a CT scan. And hopefully this will give us a little bit more insight into what's going on with you. None of the tests were reliable, I would say. We couldn't really tell what's wrong with you. Okay. You do need further evaluation, so don't lose hope. We're going to make sure that we get to the bottom of this, and we're going to make you feel a lot better. Thank you so much for coming in. I hope you enjoyed. If you did, please subscribe.